Now for dumping syndrome and GI surgeries. Dumping syndrome is when the stomach empties too quickly into the duodenum, the small intestine, after eating. This dumping causes massive fluid shift, leading to severe pain, low blood pressure, and nausea vomiting around 30 minutes after eating. Now this complication is seen after any type of bariatric surgery, like a gastric bypass or a gastrectomy, the removal of the stomach, which is typically done for bariatric clients who are morbidly obese. Now in terms of the causes, the key terms to know for your exam, write this down. Gastrojejunostomy, known as a Bill Roth II surgery, as well as partial gastrectomy or even a sleeve gastrectomy. If you see these key terms, you must think dumping syndrome here. We are in essence removing part of the stomach or most of the stomach and only left with about a thumb-sized pouch for the stomach, a really teeny tiny stomach to help those clients lose weight. So again, look for the gastrectomy here. So gastrectomy and gastrojejunostomy there. Now in terms of signs and symptoms, we must report to the HCP or the surgeon. These are priority signs and symptoms. So hypotension and tachycardia, as well as sweating, dizziness, severe abdominal pain with nausea and vomiting. And the key number here is 30 minutes after eating. Now the most critical sign here is the decreased blood pressure. This could be from rapid fluid shifts or even rupture or leakage of a surgical site within the abdomen, resulting in shock, even septic shock or hypovolemic shock, and then death. So the memory trick here, just think dumping syndrome, we see a dumping blood pressure and signs and symptoms of shock. Again, write down these key terms for a gastrectomy and bypass surgery. So a top missed Nclex question here is a client recovering from a partial gastrectomy, presenting with vomiting, severe abdominal pain, and then here, look for the low blood pressure, 105/62, with a heart rate of 122, that's over 100, and a temperature that looks like a low-grade fever, 100.5. What action should the nurse take? So again, look for the key terms. Partial gastrectomy, so we have to think dumping syndrome. Then look for the dumping blood pressure, 105/62. That's not really extremely low, but it can progress even worse. And then look for the other signs here. High heart rate, low-grade fever. This all looks like septic shock here. So just think, what kills this patient the fastest? For a gastrectomy, you have to think dumping syndrome and even septic shock from a ruptured surgical site. So looking at the options here, option 1, do we administer a bolus of IV fluid? This one could be a fluid. This one could be a technically no. Sure, the client is dumping their blood pressure, but it's not too low. The main reason could be from sepsis, that infection in the blood, showing up at that low-grade temperature. Remember, the question is asking the priority action here that the nurse should take. Now, option number 2, assess blood glucose for hypoglycemia. No, this is pretty close too, because I can see how you're thinking those signs and symptoms kind of look like hypoglycemia, the cool, clammy, and shaky. But again, let the question help you here. The big key term is gastrectomy. So you have to think dumping syndrome first. And the temperature doesn't correlate with hypoglycemia. You have to think sepsis with that high temperature, or basically a bloodborne infection here. Now, option 3, immediately notify the HCP or surgeon. Yes, this is the priority first action. Always report or notify the HCP when you see signs and symptoms of shock. Now, option 4, insert a nasogastric tube. No, this one's close. I can see if you chose that because of the vomiting here. But the question clearly states that the vital signs are indicating septic shock, specifically with the blood pressure and the temperature being elevated there. Now, moving on to post-operative care, specifically for a gastrectomy. So just think of the patho here. The patient has just had a portion or nearly all of their stomach removed. So number 1, we have to maintain NPO status until bowel sounds return. This is priority. Clients have just had their stomach chopped in half here. So go slow as we transition to clear liquids to then easily digested food. Number 2 is we apply SCDs, those sequential compression devices, to prevent the DVTs, or basically blood clots. Number 3 is early ambulation to get those bowels moving and grooving, as well as the blood flowing. And number 4 is the incentive spirometer done every hour. Now this is typical for anyone with any surgery. We're basically just reopening those sleepy alveoli after surgery to prevent deadly pneumonia infection. And number 5, teach splinting the incision when coughing, typically with a pillow to prevent dehiscence, or basically opening of that surgical site, usually from a pop suture or evisceration, as abdominal organs will actually protrude or come out of the wound in evisceration. Now, if this does happen, the priority action for dehiscence and evisceration, write this down. Number 1, stay with the client and call for help. Don't call your mama, call for help. Number 2, position in low Fowlers with knees bent. Write that down. Low Fowlers with knees bent, as other staff members are getting the sterile gauze and saline to cover the wound. And that was number 3. And number 4 is report to the HCP or surgeon. But really the biggest one here that I see most students miss on many different question banks is the low Fowlers with knees bent. So Kaplan mentions, the priority action for a client with bowels protruding through the abdomen is number 1, call for help here. The client needs emergency surgery and the nurse should not leave the client's bedside. Now, when the client is ready to go home, the key education to prevent gastric emptying and reduce the risk of dumping syndrome, the 4 Nclex key points that you should know is number 1, high protein, high fiber, and actually high fatty foods. I know it seems weird here, but protein, fiber, and fatty foods should be high. Now the key term here is low carbohydrates, since carbs empty faster than protein, fiber, and fats. Number 2 is small, frequent meals, just like with anyone with gastric problems. This eases the teeny tiny stomach back into the swing of food. Number 3 is to lie down after eating, typically on the left side, to keep food inside the stomach. Now, do not sit up after meals here, since gravity increases gastric emptying. So I know it sounds weird, but we have to teach patients to lie down after meals, specifically with those gastrectomies. And number 4, no fluids with meals. It has to be done 30 minutes before or 30 minutes after. Again, these 4 love to show up on Select All That Apply questions. So Hesse mentions, following a gastrectomy, what instructions should the nurse include to prevent dumping syndrome? Divide meals into 6 small feedings. And question number 2, which nursing action is important after a patient has a partial gastrectomy to prevent further complications? Measure the patient's serum vitamin B12 level. Now I know this sounds weird, but since nearly all the stomach is gone here, it can lead to malabsorption of B12 and could cause pernicious anemia, that low blood count caused by low B12 absorption, which we cover in the anemia section for pernicious anemia. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz.